This video will give you a brief overview of a day in the life of an intraoperative nurse. In the following section, we will cover how to locate the correct patient encounter, discuss the most commonly used sections of the patient's chart, and identify what items you will need to document at the beginning, during, and end of each case. The first item we will cover is how to select the correct patient's chart and case number that you will need to perform all of your surgical documentation within. This can be accomplished through either the case selection screen or perioperative tracking board. After logging into PowerChart, the first thing you will see is the case selection screen. The case selection screen will allow you to search for and view cases that have been scheduled at a specific location. There are several different search options to choose from, such as by date, patient name, case number, provider performing the procedure, and the patient's MRN or medical record number. Once you have selected which search option you would like, you will need to complete the criteria details section. For example, when searching by date, you will need to enter the beginning and end dates you would like to view cases for. After entering the search dates, selecting Retrieve will perform the search. On the far right, the checkbox can help you determine if a patient has arrived and been checked in for their scheduled case. Before opening a patient's chart, it is important to always verify that the FIN number located on the patient's armband matches the FIN shown on the case selection screen. The FIN, or Financial Identification Number, is the unique number assigned for this stay or visit. You need to be on the correct FIN in order for the charting to be done on the right case. Otherwise, you will have to rechart the entire case. To open the patient's chart, simply double-click on their name. The second method you can use to locate the correct surgical encounter for your patient is by using the perioperative tracking board. To view the perioperative tracking board, simply select the option from the toolbar shown at the top of your screen. The perioperative tracking board displays information similar to the case selection screen. However, it is arranged by room number or OR suites. You will also notice various tabs across the top showing different phases of the operative process or different locations, such as the EP lab or special procedures unit. The tab options may differ from one person to the next, depending on their role. For the intraoperative nurse, the perioperative tracking board is typically where you will be choosing your case from. Please note that the patient's FIN number is not located on the perioperative tracking board. To find your patient, locate your room number and case time. To open your patient's chart, select the blue arrow to the left of their case number. After selecting the appropriate relationship type and clicking OK, the patient's chart will open. Once the patient's chart has opened, you will need to verify that the patient name and FIN number on the screen matches the patient's armband. In the next section, we will review some of the most common areas of the patient's chart used by the intraoperative nurse. As a surgical nurse, the first screen you will see when you open the patient's chart is the perioperative summary page. This page has different tabs at the top, allowing you to see the preoperative, intraoperative, or postoperative information. For this video, we will briefly cover the preoperative summary. The preoperative summary page is a place where you can quickly review patient information such as allergies, diagnoses, medications, lab results, and the preoperative checklist. To see more information about a certain section, simply double-click on the name and you will be taken directly to that place in the patient's chart. You can also navigate through the patient's chart by using the menu bar on the left. Frequently used menu items include the documentation and history sections. As you become more familiar with the electronic record, you will also discover that there are multiple ways you can review patient data. For example, if you would like to review a patient's allergies, you can refer to the allergy section within the pre-op summary page, the patient information bar, or by clicking on the Allergies tab. One of your most frequently used menu options will be the Perioperative Dock. All of your intraoperative documentation will be charted in this area. To begin charting, you will need to choose the intraoperative record from the list of options. Selecting OK will open the document. You are now ready to start your case.